Yeah, okay. Dear Chair, ladies and gentlemen, basically I would like firstly to thank ESOPRS and especially Yanis and George for the kind invitation. In the next 6 or 7 minutes, I'm going to just debate with Jane on the issue of basically external versus endonasal DCR, in which I'm going to review 7 key points briefly based on the literature review and our experience, even though we don't have that many papers comparing these two procedures together, just 23. When it comes to randomized clinical trial, you would see just one and one meta-analysis. So let's get started with the success, especially when it's targeting the pondo and functional nasolacrimal, because the other etiologies is not covered by the endo. When you go to the literature, consistently, you will find much higher success for the external BCR, and as you see, the osteum size in the comparative report recently published shows almost twice larger osteum size for the external DCR, and in only one randomized clinical trial, you would see again higher success rate for external DCR, even though it was insignificant. We compared our cases with endo versus external DCR, in which we found significant difference between the external, favoring the external DCR in terms of the anatomical and functional success. And the only article published on the functional nasolacrimal duct obstruction comparing these two procedures, Jane reported 100% success for the external DCR, but less for the endo. And that's why, in a survey amongst ESOPRS members, the majority chose external DCR mostly for its